We try very hard these days to not use radiation, because what we've learned over time is that radiation at a young age not only causes decrease in growth, the bones don't grow or the muscles don't grow the way they should when they're exposed to radiation, but also that the risk of secondary cancers is even higher in people who are treated as children when they become adults. So when we treat, for example, a young woman who's in her teens for Hodgkin's disease and the breasts are in the field, the risk of breast cancer 15, 20 years later goes up significantly. And I know that there are other experts who are discussing risk of secondary cancers, and they'll probably talk about the need for screening for breast cancer. But thinking about that in a very young woman is something that sometimes primary care providers don't think about when they see a Hodgkin's survivor. Let's say a young woman who's 25 years old who was treated when she was 12 for Hodgkin's and got radiation. That's about the time one would start thinking about mammograms and about breast MRI, around age 26. But to talk to a primary care provider about that, the primary care provider may not be aware of the recommendations or may think, gee, that's awfully young to start breast cancer screening. You don't have a family history of breast cancer. Another thing that I think is very important for Hodgkin's disease survivors who've gotten radiation, and for everyone, is to be aware about the risk of skin cancer and the role of sun protection and the role of sun causing skin cancer. If you've had radiation, skin cancer, you're at higher risk for skin cancer. And we really encourage people to use sun protection and to avoid tanning beds. And these are, getting a lot of sun and getting tan and the sort of cosmetic reasons that one might want to be out in the sun are things that are particularly important to people in their 20s who might have been treated when they were teenagers or children. And we really need to talk about those kinds of things so that people are aware that it would increase their risks. And then, they may not be people who really want to be suntan, but they may be people who are doing just what people in their 20s should be doing, being out, running and doing outdoor activities and playing sports, and just knowing that wearing a hat and wearing sunscreen is an important thing to do.